Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
The second important is scleritis. Right. Now, scleritis occurs, it is an autosomal dysregulation. Scleritis mainly occurs due to an autoimmune dysregulation. Here, it is mainly the scleritis is associated with many autoimmune diseases, like it is associated with many autoimmune diseases like rheumatoid arthritis and others. So here the patient will present with pain which is subacute in onset, and it is severe pain is seen in the patients, and this severe pain is seen, and the pain is seen with eye movements also. The patient also presents with blurred vision or vision loss and photophobia. In scleritis, there is severe pain is present with eye movement, and there is blurred vision, vision loss, and photophobia is seen in the patients. On examination, adherent vessels are seen, and these vessels, if you add phenylephrine drops to the eye, and on adding the phenylephrine drops to the eye, these will not blanch on adding the phenylephrine drops, whereas episcleritis vessels will blanch on applying phenylephrine drops. These have bluish hue, and if you do a slit lamp examination, because it is associated with autoimmune diseases, this may show the presence of nodules. Scleral thinning and corneal changes may be seen. Nodule, scleral thinning, and corneal changes may be seen here. There is systemic inflammation is also associated with this, like the patient can have joint pain and rashes can be seen, especially because it is associated with an autoimmune disease. Treatment of the patient is, you should give the patient systemic steroids or NSAIDs can be given along with or without topical antibiotics based on the infection status of the individual. So these scleritis will look something like this. So scleritis is complete, many vessels are seen which are adherent to the sclera, and these vessels do not blanch with phenylephrine drops.
thank you and thank you for watching.